the 7 illnesses patients are being able to see pharmacists rather than GPs. We're going to read into this more from the Independent, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here. An article from the Independent with the headline, "The 7 illnesses patients are being told to see pharmacists for rather than GPs." The new NHS scheme is intended to give people more places to access care, freeing up 10 million GP appointments a year. So guys, before I give my thoughts, if you can hit the like button and share it across social media so other people are notified of this video. Now, this is there's a number of things about this that comes to my mind when I think about this headline and I think about what the intention here is. Now, on one hand, you might think, oh, in a positive thing, is that it's good that rather than people going to their GP, that they could go to a pharmacy instead to be able to get some care, to try and take alleviate off our NHS, which is overwhelmed. And I do see some of that. I do see some of the positive for that. I see the reason why people will want to do that. And normally now when people are unwell or whatever, I try to encourage people to go and see a pharmacist or a chemist before trying to go and get a GP appointment. I would recommend, if you can. If obviously you can't, I understand you need to go to the doctors in order to try and give the NHS the best possible in their situation, but also that may be something that the pharmacy may be able to help you with something. Now, obviously, not all things can be dealt with at the pharmacy, and obviously you need to see that doctor, that more closer thing than a pharmacist. Obviously, one of the other things as well is that even I don't need to read the article to know, or been reading things to know that even pharmacies have been struggling, because quite frankly, when you have an NHS that is already overwhelmed, that people aren't getting enough appointments, that we know people aren't getting enough treatments and stuff, they will turn to a pharmacy for help, because they will look at trying to take something that the pharmacy can give them, because they to something to alleviate the pain and suffering or whatever that they're going through, to try and help them. So I do think that has played a factor into it too. My problem is that I see this as more of a reason. My theory is that this is more of a reason to privatise more of the NHS, as if it's not the vast majority of it already, to push people into basically paying, because what I think is going to happen is that the idea is that as they push people towards these pharmacies, and that's how it, rather than the GPs, pushes them in towards paying for certain medications for certain things. You know where this is going. That's how I'm seeing this. I'm not seeing this as a means. I'm seeing this more as a means to push people to put their hand in their pockets for help, as a means to actually dealing with the national healthcare crisis. And this is just a way of them saying, look what we're doing here. Then we know that 14 years ago we had one of the best healthcare services on the planet. We were deemed one of the best healthcare services, and everyone loved and appreciated the national healthcare and what it done. 14 years later, there's mixed views now, and it is because of what this political party has done. It's not because of the doctors and nurses. It's because of what's happened over the last 14 years, and it's really important I keep emphasising that as well. I see benefits to this, and I see benefits to this scheme, but I also see negativities for this scheme, because my fear is that this will continue to lead down the path towards more privatisation, and eventually, that point of where people will have to pay out of their own pocket for healthcare, because that's the ultimate goal for the Conservative Party and the people behind the scenes, the puppet masters pulling the strings, is they want you, the ordinary person, to be paying out of their pocket for that cancer treatment, for that healthcare that you have. And eventually get down this point to where even businesses opening up health insurance, basically a monopoly like they have in America, that kind of thing, opening up a new market, because that's kind of what the Conservatives do, and that's where I fear this is going. But I also can understand why people will see the positives in this headline as well. So patients can now get a treatment for 7 common conditions without needing to see a GP under a shake-up of pharmacy services. From Wednesday, so it'll be already in place, thousands of pharmacies across England will be able to access and treat patients for sinusitis, sore throat, earache, infected insect bites, shingles, and unaccompanied urinary tract infections in women under 65 without the need for a GP appointment or prescription. So the first thing comes to my mind is that if they go to these pharmacies, that's the first question that comes to my mind. Will they have to pay for it? That's the first question we have to ask ourselves. Are they going to pay for it? Are we going to have to pay for that? That's the first question. NHS England said more than 9 in 10 community pharmacies in England, 10,265 in total, will be offered checks under the first pharmacy scheme. The move is intended to give people more places to get the care they need, freeing up 10 million GP appointments a year. Pharmacies will receive an initial fixed payment of £2,000 each for providing the scheme, plus £15 per consultation for a monthly fixed payment of £1,000 if they do the minimum number of consultations. Doesn't say whether or not people have to pay for this. I want to know whether or not we're going to be paying for this, and this is the question. It's all well and good saying this stuff, but people will want to know if they're going to turn up, unless they get an approval from the GP on the phone or something. I mean, that's. I mean, is this it? I mean, the other thing as well is that pharmacies are already struggling, and this is the big question that I have. NHS Chief Executive Amanda Pritchard said GPs are already treating millions more people every month than before the pandemic, but with an ageing population and growing demand, we know the NHS needs to give more people more choice and make accessing care as easy as possible. People right across England rightly value the support they receive from their high street pharmacy, and with 8 in 10 living within a 20-minute walk of a pharmacy, twice as many pharmacies in area deprivatization, they are a perfect spot to offer people convenient care for common conditions. Prime Minister Sunak says community pharmacies already do a tremendous job in treating minor conditions, with the Pharmacy First scheme backed by £645 million will determined to go further and unlock their full potential to deliver routine care. Again, guys, this is down the privatisation route. This is what this is. Patients who need treatment or prescription Medicare for common conditions like earache will now be able to get it directly from a pharmacy without a GP appointment. This is about ensuring people get the treatment they need closer to home, while crucially helping deliver on a plan to cut waiting lists by freeing up 10 million GP appointments a year so that people can get the care they need more quickly. My fear is that because Wes Streeting is likely to be the next health secretary under Labour government, he will not reverse this policy. And again, I see the benefits, but I see the benefits of trying to free up stuff on the NHS. But this shadow of people paying out of their own pocket, it's just a thing that bothers me, guys. Dr. Leah Hannenbeck, Chief Executive of the Association of Independent Multiple Pharmacies, welcomed the move but warned that pharmacies are severely underfunded to the tune of $1.2 billion now as a direct result of the reducing opening hours and even closing completely. She added, this nonsense cannot go on, and this stranglehold of chronic underfunding must be relieved now to ensure that our community pharmacies continue to exist and can deliver to the potential the government is expecting. So basically, they're already saying that, yeah, okay, it's nice, but we could do with some money to help with this. Asked about the concerns, Health Minister Dame Andrea Leadsom told Times Radio, we obviously keep a very close eye on pharmacies opening and closing, and how many do open as well as close. There have been a net reduction, but not a huge one. 4 in 5 of us live within a 20-minute walk of pharmacy, and we're in the more deprived areas, and there are twice as many pharmacies, so we are very well served. They are private businesses, but the department does keep a close eye on them. There's that word, private. And of course, we do provide them each year with a significant sum of NHS money, which is £2.6 billion per year, and we're about to start negotiations for the 24th-25th contract. Paul Reeves, Chief Executive of the National Pharmacy Association, said the scheme will play to the strengths of the pharmacies as medicine experts and free up GPs for other works. Patients will get convenient clinical advice close to where they live, work and shop, he added. The pharmacy sector is under great pressure, but despite this, pharmacy teams will step up and deliver successful, highly beneficial services. This could be a stepping stone to the development of other NHS clinical services in the future as patients become more familiar with their local pharmacy for primary care. Dame Andrea told Sky News the initiative will allow GPs to focus on their more complex cases. She said it would also increase footfall through the pharmacy sector, adding what we're seeing as the UK government is a thriving sector that can do more to work to the top of their training. Again, this is just marketing. It feels like marketing, people. Like that's how it comes across to me, guys. And I can understand, again, I can understand people will say the benefits of this, but this just doesn't sit right with me. As I said, guys, are we going to be paying for this? I think are we going to be paying for this is the key question. Well, the answer is yes, we are paying for it, because the NHS is providing funding from its own budget to it. I don't know. I'm assuming that we're not paying out of pocket to it, but I just think that while I appreciate, we want to improve the pharmacy sector, they're not dealing, in my opinion, the main issues with the doctors and the nurses who want better pay in terms and conditions, and the way that funding is being handled in the NHS. I think there are the questions that need to be asked about that. But I am greatly concerned about the direction that this is going. Yeah, I'm not 100% convinced with this, guys. Now, but what do you guys honestly think about this? Pharmacies taking on more work when they're kind of already having enough as it is. Do you see this as nothing more than marketisation, the downfall of the NHS, and more towards privatisation, as they look to expand to push more and more people off the NHS and onto private companies, private sectors, and that kind of thing? Is that the direction you see it as going? Because that's where I think it's going, guys. Let me know what you guys' thoughts are in the comment section down below. If you found this video interesting, hit the like button. It'd be greatly appreciated, and share this across social media so other people are aware of this video. And if you can, subscribe, because it really does help support the channel, and hit the bell notification icon so you'll be notified when I upload another video. And if you want to financially support me, you guys, you can do so by becoming a YouTube member for as little as 99p, or join me on Patreon for exclusive content. Thanks so much for watching, guys, and I hope to catch you all very, very soon.